In the United States, almost 1 in every 3 Americans is considered obese. Obesity is a serious chronic disease that can have a negative effect on many systems in your body. People with severe obesity are more likely to have other diseases as well. Weight loss surgery, known medically as bariatric surgery, could drastically improve your health, happiness, and lifespan. Could you or someone you love be a candidate for this life-saving and life-changing procedure? Stay tuned as we discuss bariatric surgery at Catholic Health Services on today's episode of CHS Presents, Lifestyles at the Heart of Health. Hello, everyone. Thanks so much for joining us. I'm Jane Hansen. Making the choice to become a new, healthier you through bariatric surgery begins with obtaining the information you need to know about your medical condition and the weight loss surgery solutions and support groups that can offer you a new outlook on life. As some of the most experienced bariatric surgeons in the region, the doctors at Catholic Health Services know how important it is to select the right weight loss options for patients who are facing serious health challenges from chronic obesity. Joining me now to discuss these options is bariatric surgeon Dr. Nick Saker, a member of the New York Bariatric Group and Catholic Health Services of Long Island. Thank you so much for being with us today.
Thank you so much for having me here. It's a pleasure.
This must be a very rewarding kind of surgery to do for people who I would assume have been fighting weight for most of their life and it's really had a bad effect on them.
Exactly. It's a gratifying procedure for the patient as well as myself, because I meet patients who the surgery is a game changer for. They're individuals who may not have had the energy to get on a roller coaster or get on public transportation or chase after their grandchildren, and now they have the energy to do that. They have the body size that lets them fit in those smaller seats. They have the thirst for life that they were missing before the surgery. And it's an incredible transformation that I get to witness on a daily basis.
How many of these surgeries do you do a year?
So these types of surgeries in the hundreds. We do at least, as a group, we do over 1,200 surgeries a year within the CHS system.
So when we talk about bariatric surgery, we're really, there's not just one kind. I mean, we used to talk about gastric bypass, now we talk about lap surgery or lap band and talk about the sleeve, etc. So explain what the different types are.
So there are 3 different types of surgeries that we offer to patients. The first one and the most popular is known as the laparoscopic sleeve gastrectomy. In this procedure, we make the stomach into a smaller tube, and we remove the part of the stomach that causes hunger in the body. So the amazing thing to see in these patients is the lack of desire that they have for the food items that may have thrown them off the rails of a diet before the surgery. Their metabolism is also transformed. So before the surgery, whatever they ate may have been stored as fat. Because the body is not trained for diets. The body sees diet loss and weight loss attempts as famine. So when the body sees that condition, it goes into a defense mechanism where the next opportunity to eat is replaced by that lower metabolism, which causes an accumulation of fat. So in some ways, we trick the body into feeling satisfied all the time after this surgery, which is really a game changer for patients. The other surgery that we do primarily is called the laparoscopic adjustable gastric band, which I have a model of here on the table. This is a very safe surgery. It requires about 30 minutes of time in the operating room to perform for most patients. And it involves implanting a silicone adjustable band around the top of the stomach to make a smaller stomach above that band. And it can be adjusted. Thus, it's referring to as the adjustable band. And we can actually adjust it through a little port that sits under the skin, and we can add and subtract saline from this little donut that sits around the stomach.
To make it bigger or smaller?
To make it bigger or smaller. And it's very attractive to some patients because it's reversible. We can take all the fluid out, and it's as if you have a normal stomach.
What about the original, the gastric bypass? Do you do that as much anymore?
We don't do that as much anymore. What we've noticed is that patients have just as much weight loss with the sleeve, but without some of the complications that were often unavoidable with the gastric bypass.
So who's a candidate?
If a patient has a BMI over
Body
30,
mass index.
Body mass index, and there's a formula for calculating that, which involves your weight in kilograms over height in meters squared. But the bottom line is that if your BMI, if that number is over 30, you would qualify for one of our surgeries, the band. Mm-hmm. If your BMI is over 35 and you have a comorbidity, the most common comorbidity or disease associated with obesity that we see patients with is something called sleep apnea. And most patients who have sleep apnea snore or find themselves being very tired during the day, or they have a very unhappy wife or husband who has to listen to them snore all night. So that's how we help patients, is by finding the right surgery for each patient. And a lot of it involves patient input as well. They steer a lot of the discussion towards which surgery they are interested in.
Sure, and it depends, I guess, too, on a number of other factors. Now, if you have this surgery, what kind of downtime is there from it?
The downtime is an overnight stay in the hospital. And depending on the work, if you work at a desk job, I've had some patients who are back at the office the next week. If you have a strenuous job like one of our patients you're going to meet, they may have to be off of work for 4 weeks, just because we really don't want them getting into a real heavy physical job when they're still recovering from the surgery.
Now, what about if you've got some other kinds of things that may come from obesity, because sometimes heart disease or diabetes or some of those kinds of things? Are you still a candidate?
Yes, and we can actually reverse the course of those diseases with the surgery. That's one of the miracles of the surgery, is that on top of the lifestyle benefits that the weight loss comes with, we also cure sleep apnea, we cure diabetes, we cure hypercholesterolemia. It works much better than medications and even patients' attempts at weight loss.
Does that mean somebody who has diabetes but might not be truly obese should have this kind of surgery?
Exactly. We take care of patients who have diabetes who, to the outside observer, may not look obese, but their BMI may be over 35 and they may have one or two of those comorbidities. And they do exceptionally well with the surgery, and we get patients off of their diabetes medications.
Yeah, to have you say those words, "we cure diabetes," that's pretty amazing. That's quite a statement to make.
It is really amazing, and the more amazing thing is that it's backed up by science, and that we have many randomized trials that compare surgery to medically managed treatments for diabetes and for other comorbidities. And an interesting statistic is that surgery is actually safer than not having surgery.
That's amazing. I have learned so much in just this brief period of time, and we're going to learn even more, because coming up, we are going to actually meet one of Dr. Saker's patients who's had quite a successful surgery and process here. So don't go away, because we'll be right back. A lot more on CHS Presents Lifestyles at the Heart of Health right after this. Welcome back to CHS Presents Lifestyles at the Heart of Health. And joining us now is a patient of Dr. Saker's, Rick DeAngelis. Welcome. Good to have you here.
Thank you for having me.
So you're like a third of the size you used to be, or 2/3, right?
Yeah, about a third.
A third. You lost how much weight?
100 pounds.
Amazing. So how do you feel? How has your life changed? Tell us everything.
I feel great. My life's changed a lot. My health is better. My blood pressures are off, pills. Cholesterol's down. My aches and pains are gone. And my sleep apnea is totally gone.
It took you a while to decide to do this.
Yeah, about 8 months of research.
And your girlfriend actually did it first.
Yes, she did it in November.
And then was it because she was so successful at it that you decided to actually bite the bullet, or what happened?
Both of that, and I dragged my feet a little bit. You know, I did all the fad diets and things like that, but it started to hinder me and slow me down a little bit in life. So I started to see effect in my personal life and my professional life. So.
And your professional life is you do what?
I'm a police officer.
So as a police officer, you got to move fast.
Yes.
A lot of motion.
Yes.
So that must have really been affecting you to be carrying, what did you weigh then?
330 pounds.
330 pounds? And look at you now.
Yep.
That's amazing.
Yeah.
But you had a lot of quick success, from what I understand. I mean, the weight just really dropped off after the surgery. And does that happen with every patient?
That doesn't happen with everyone. Rick is one of my star patients, and he's a friend of mine. He's a great person, and what he did, which was so incredible, was he really stuck to the pre-op liquid diet. And I think that's a real marker for success with the surgery. If you are compliant with the diet, you are going to do extremely well after the surgery, because that really decides what choices you make after the surgery. The surgery is a tool, and Rick is very successful because he uses it as a perfect tool. He sticks to the diet, and he also exercises.
You were on this diet at Thanksgiving time.
Yes.
What did you have to eat?
I had a cup of Greek yogurt with blueberries in it.
So no turkey for you last year.
No turkey last year.
Well, so what do you eat now?
I ate a lot of chicken, fish, vegetables. No pasta no more, no bread.
Really?
Man, I love that.
I know. So do I. Is that typical that you stop eating those carbohydrates?
Patients definitely lose a desire for some of the food that threw them off the rails of the diet before the surgery. And a lot of that is secondary to the surgery. We actually remove the part of the stomach that controls hunger and some of that desire for food, as well as the part of the stomach that really directs the body's metabolism.
Well, I always thought that was more in the brain than in the stomach, that it was our brains that really controlled that. No?
And luckily for us as stomach surgeons, we find it a lot easier to operate on the stomach than the brain.
I think so.
We were able to get to his hunger center a lot easier through his stomach. And it's something that works out really well for patients. We actually never realized this until recently, and we see a lot of our patients becoming extremely successful with the sleeve gastrectomy, which is a surgery that Rick had. It's safer. It takes about 30 minutes under the operating room, and patients have less complications than they did with some of the older procedures.
You said that you tried diet after diet after diet, so I'm assuming this was a process that went on for years.
Yeah, I yo-yoed up and down for probably the last 20 years. I never let the weight hinder me. It just started slowing me down. You know, I'm still very active, still ran, exercised, went to the gym, but the weight started getting to be where, you know, bothering my knees and my back and sleeping, you know.
Do you find that people treat you differently now that you are so much thinner?
Some people do. Some people are still amazed because, you know, my nickname at work had to do with being big. They used to call me, my last name is DeAngelis, so they used to call me Heavy D.
Heavy D?
That was my nickname, and now it's a joke. People don't call me that more. Now they call me D Light and things like that because people are very happy they lost weight because it's a health conscious thing. it also makes you feel better. It's better. And I love talking about it. I talk to people all the time about it.
Have you convinced other people to have this
Yes.
surgery?
I've referred several people to the doctor.
And what about your girlfriend? She's lost, I know you've lost over 100 pounds. She's lost what?
I think close to 70 or 80 pounds.
Wow, and she's also your patient. And did she do the same kind of regimen at the beginning?
Yes, we do everything together. We eat together. We eat the same foods. We cook. I cook in the morning. I just cooked breakfast this morning.
What
We
do you
split
have?
it. This morning we had eggs with cheese and turkey. We eat 3 eggs. We split it in the middle.
Wow, and then how about what's typical for lunch and dinner?
Lunch we had some chicken salad with walnuts and raspberries. I mean not raspberries, cranberries. And dinner we'll have chicken with some vegetable or something to that effect.
And do you not crave sweets? Do you not crave
Sometimes.
any of that stuff?
Yeah. The other day I craved the oatmeal raisin cookies, so I ate half of one. But that's nothing, you know. It's you have to feed your cravings, I think, sometimes. Nothing bad.
Yeah, but I bet you used to feed your cravings when you were yo-yo dieting all the time.
I used to eat a lot of food, and I loved food. And I used to live to eat. Now I eat to live, you know. I used to love to eat. You put food in front of me, I'll eat anything. I'm a food guy. I wasn't a big junk food guy, just food. You know, Italian food, Irish food. I eat very well at work, too. So.
So what you're talking about here is his metabolism has totally changed as well.
Correct. We have changed a level of a hormone in his blood called ghrelin, which causes hunger, and it also interacts with insulin. And there's a host of hormones that we've removed from his body that we don't even have names for. And we don't fully understand why some of these effects happen, but we see the effects and we're grateful for them because our patients really benefit from the surgery. Their diabetes is cured, their sleep apnea is cured. Even some illnesses that you wouldn't think were associated with obesity, the risk goes down dramatically, like some types of cancer.
Oh, wow. So did you have any bad side effects, though? I mean, or were you concerned that you might have?
Unfortunately, I'm a perfect patient for that fact. I had no side effects. My biggest side effect was after the procedure, they fill your cavity with gas, getting that out. And that was the worst part, and that's the first 24 hours. I mean, I took no painkillers after the surgery. I took aspirin and, not aspirin, Tylenol, I'm sorry. And within the first 24 hours, I was back on the treadmill walking.
You were back on the treadmill within 24 hours? Was that
Yeah.
recommended, or did he kind of not follow your orders?
No, he followed the instructions to the letter. And we actually have our patients walking around the recovery room in some cases. We encourage our patients to be active immediately after the surgery.
If he had no side effects, is that unusual? I mean, what could there possibly be?
It's not unusual for our patients. Part of that comes from our experience with the surgery. It's very unusual for our patients to have problems with the surgery.
Well, we're going to continue this discussion in just a moment because we have to take a quick break. So stay with us. We will return after this. Welcome back to CHS Presents Lifestyles at the Heart of Health. So let's continue this discussion. I'm not sure we've made it really clear to the people that are watching about where you do this within Catholic Health Services. So it's St. Francis, Mercy. Can you just talk a little bit about those programs?
Yes. I see patients at 4 of the CHS hospitals: St. Francis, St. Catherine's, Mercy, and St. Charles. We've been doing surgery very successfully at 2 of the hospitals, Mercy and St. Charles, but we've been reinvigorating the programs at St. Francis and St. Catherine's. So we like to tell patients that we are near where they live. We have a hospital or an office close and convenient for most patients in Long Island.
So you're geographically perfect.
Exactly.
For nearly anybody that's out here. Now, which leads me to this other idea of the support that one needs both pre and post the operation. I know there's lots of support groups. Did you do that?
My girlfriend belongs to one. It's an online group. And then my support is I have 3 people that have had the surgery. We all discuss it, talk.
Is it important to be able to do that?
I think it is because a gentleman I know that had the surgery about 2 months after I did, didn't have as great support. Now I phoned with him and talked to him. We exchanged different ideas, and I give him food ideas too, because there's a lot of food, different things we make that are really good.
So you even have like your own recipes and that sort of thing?
I got some really good turkey
I got
chili
an
recipe.
idea for you. Delight, it's cookbook.
We might have to do that.
I think that would be great.
Yeah.
So these support groups, so they're offered through all of the hospitals and through all of the surgery, correct? So that people can make sure they're on the right path both before and after.
Yes, we have online and in-person support groups. The best source for the schedule of that support group is stopobesityforlife.com. That's
stopobesityforlife.com. Okay.
correct. And that has a list of our seminars, information sessions, also a lot of resources for patients who are considering beginning that journey toward surgery or who are looking for success after their surgery.
And is that hard for some people? I mean, obviously for you, Rick, it wasn't an issue, but I gotta believe for some people it is.
For some people, it definitely becomes an issue. The willpower definitely can start to creep back down a year or 2 after the surgery, and that's when the support group is essential. It's important to talk to other patients, to doctors, people with more experience with the surgery, because they've all gone through that experience before. You're not alone, and there are other people in your shoes who can help you with any problems that you're having.
Is this covered by insurance?
It is covered by insurance. It is well documented that the surgery is safer than medical management alone for morbid obesity. So the insurance companies, the medical societies are all on board with surgery as a treatment.
And then I would assume that this surgery probably gets easier and easier. A, the more you do it. B, the sleeve is it's the next generation. So all of that has made, with the technology, has made it a much simpler and probably more successful surgery.
Correct. The technology has vastly improved even since I started doing the surgery, which was in the early 2000s. The staplers are much, much safer now. The techniques that we use have improved with time and with our experience. We do over 1,200 surgeries a year as a group.
What's the best thing that somebody has ever said to you after they've had the surgery?
The best thing that patients say to me is that you changed my life. And that never gets old. And
I'm sure not.
I wanted to thank Rick for being with us today because he's a great person and a great patient.
When you think about your life a year ago and what it is today, what runs through your head?
It's a lot different. The doctor, I don't want to use the word save me, but the doctor did a big fix on me, and I can't say nothing but great things about the doctor. I recommend the people. When I tell people about the surgery, I try to work through their problems or their, resilience to do it, and I tell them to go see the doctor because I think he has also, besides being an excellent doctor, he has an excellent personality and an excellent way of talking to people because I was very skeptic about doing it, and when I spoke to the doctor, he really made me feel comfortable.
And are you happy that you did it?
Excellent, very happy. It's the best thing I ever did.
Well, thank you for sharing all of that with us.
Thank you for having us.
And I'm so happy that you've had these tremendous results.
Thank you very much.
And
Thank
I assure you to buy a whole new wardrobe, right?
I'm in the middle of it doing it still. Every season I buy new clothes.
Isn't that great? I love it. Thank you for being here,
Thank
Rick.
you very
Dr.
much.
Sacred.
Thank
Keep
you,
up the
Jane.
good work.
Thank you, Jane.
And of course, for more information or to schedule an appointment with Catholic Health Services, simply call 855-CHS-4500 or you can visit chsli.org. Thank you so much for joining us today. I'm Jane Hanson, wishing you goodbye and good health.